Welcome to Crossover Healthcare Ministry. My name is Sarah Labrini, and I'm the Electronic Health Records Coordinator here at Crossover. Today, I will be training you on how to use eClinicalWorks as a volunteer clinician at Crossover. This video is also suitable for medical residents and volunteer scribes. To accompany this training, we have provided you with two EHR training guides. The first is the eClinicalWorks Clinician Training Guide, and the second is the Medication and ePrescribing Guide. If you are a resident, you have an additional guide on the co-signing procedure. These guides are specific to Crossover. We have found that these guides are most useful when you familiarize yourself with them during the training, so please follow along in the guides as we go through today's training. The section titles in the video will match those in the eClinicalWorks guides, and we'll put page numbers on the bottom left of the screen to help you follow along in the guides. This training video works best when you do the steps with me on a test computer. So as we go through today's training, please do the steps with me along on your training computers. For today's training, you will be working with a test patient that I've loaded into the schedule for today. Please choose one test patient on that schedule and use the same one all the way through the training. If there are multiple people in this training, please ensure that you are each working with a different test patient. Let's get started.
When you log into eClinicalWorks as a clinician, your home screen will be set to what is called the Office Visit screen. As you navigate through today's training and would like to return to this screen, click on the S Jelly Bean, which is located on the top right of the screen. There is a difference between the S Jelly Bean and the S letter, so be sure to click on the Jelly Bean, not the letter S. The Office Visit screen displays the list of appointments for a selected provider on a specified day and time. When you come in for your shifts, the first thing you will do is set the Office Visit screen to display the name of the provider whose schedule you would like to view. If you are a resident, you will select the R for Resources and find the name of your residency program in the drop-down menu. For example, VCU IM Resident or St. Francis Resident. If you are a volunteer clinician not coming in through a residency program, your name will be under P for Providers, and you'll select your name from the drop-down menu. Today we are going to be working under Dr. Murchie's schedule, so let's navigate to the P and then select Dr. Murchie from the drop-down menu. Next, set the location for the clinic that you will be serving at that day. To select the location, click on the SEL button. Select the name of the clinic you are serving at, and click OK. Today we will be at Crossover Western Henrico. Where it says appointment time, you can choose to just view the morning or afternoon. I'll leave it on all day for now. In the first column, you will see visit types. Visit types tell you what kind of appointment a patient has. Some common ones for primary care are ESTPT, which is an established patient visit. NP is a new patient visit. You'll see different visit types for specialists. Next, let's look at the reason field. The reason field shows you what kind of template is loaded into the progress notes. For example, the reason field here shows primary care template has been loaded into the note, and please note that the reason field does not tell you the actual reason for the appointment, it simply loads the template. The visit status column shows you whether or not the patient has arrived. The red CHK means they've checked out. The green ARR means they have arrived. And the white PEN means it's a future appointment, it's pending. So the patient has not yet checked in. Then you have the arrival time, the room number, and the status column. The status column all the way to the right is our way of notifying the rest of the clinical team where the patient is in their appointment. When the nurse takes the patient back, they change the status to NUR for nurse. Then, when the nurse is finished seeing the patient, they change the status to ready to be seen to alert the clinician that the patient is ready for them. When the clinician is ready to see the patient, they change the status to Start Visit. Then, when the clinician finishes seeing the patient, they change the status to All Done. In this way, we are able to see where the patient is in their visit at Crossover. So let's go ahead and click on Start Visit, since we're going to go into the room with the patient. Lastly, the stethoscope on the right indicates that the patient's vitals have been taken. We're going to go into our patient's progress notes now, but before we go in, this is a reminder to follow along with me on your training computers, so please do everything on your screen that you see me doing on my screen. To enter the patient's progress note, you double-click on their name, and you will get a pop-up asking if you'd like to load the template in. Say yes to this pop-up. Then you'll get a second pop-up asking if you would like to load the current medication in, and you want to say yes to this as well. Now the progress note will load onto the screen. Let's examine the layout of the screen. At the top, we have what is called the top taskbar. To the right, we have the right chart panel. The white rectangle in the middle is called the progress note, and this is where you will enter your notes. In the orange box in the top taskbar, you will see the language the patient speaks and whether or not they need a translator. Sometimes we have volunteer interpreters in the clinics. Please speak with the front office to identify if there is an interpreter available. If we do not have anyone available who can speak that language, use the language line. The language line is a phone interpreting service that connects you to an interpreter for the language that the patient speaks. Instructions for this can be found in the nursing station. In preparing to see your patient, you'll often want to read through their past appointments. To do this, click on the Encounters button. Encounters will show you the patient's appointment history. The appointments in bold are for today or the future. Those not in bold are the past. The Type column will show you what kind of appointment this patient had at Crossover. Keep in mind that in addition to primary care, we have specialty appointments as well as dental, eye, mental health, and behavioral health appointments. Use the Type column in conjunction with the appointment provider and the resource field, as well as the reason field, in order to determine who the patient had an appointment with. When you are ready to view a past appointment, simply double-click on the row you'd like to view. A viewer window will open with a screenshot version of the progress notes from that visit. Use the scroll bar to view the note. When you are finished viewing the note, use the X at the top to exit the progress note, then exit the Encounters screen. Next, in preparing to see your patient, you may be interested in viewing the patient's lab results. Click on the Lab button in the top taskbar. The lab screen will show you the orders that have been placed for this patient at Crossover. If the lab is an in-house lab, we will see an abbreviated version of the result in the Result column. Double-click on that in-house order to view more results. Scroll down in the Result box until you see the yellow row. The yellow row indicates the order date of that lab order. These columns will show you the results. When you're finished viewing the results, exit the lab results screen and you'll return to the lab order screen. If the lab was sent outside of Crossover, we will receive the results electronically in the form of a paperclip. Click on the paperclip in order to view the results. When you are finished viewing the results, click on the X to return to the lab order screen. When you are finished viewing the lab order results, you will close the lab screen. Next, you may be interested in viewing the patient's diagnostic imaging results. These can be found in the DI section directly to the right of Labs. Click on DI. This screen displays all the diagnostic imaging orders that have been placed for this patient at Crossover. When we receive the results for a diagnostic imaging order, it will be attached to the order as a paperclip. Click on the paperclip to view the results. When you are finished viewing the results, exit the screen and exit the diagnostic imaging window. Occasionally, you will not be able to find the results in lab or DI areas because it was scanned into our system. For example, oftentimes patients give us medical records, hospital discharge papers, or test results they received outside of Crossover. So we scan them into a place called Patient Docs. Click on Patient Docs. You will see folders on the left which contain documents. If there's a document in the folder, it will appear under that folder on a branch with the green diamond. When you click on the document in that folder, the document will open in the area to the right. Use the scroll bar to view the results. Notice that at the top right, there is a page navigator. Use these arrows to navigate through the pages of the document. When you are finished viewing the patient documents, exit the patient documents window. Now that we have prepared to see our patient, we are going to look at how to input notes into the progress note. You will see in your Clinician EHR Training guide that there is a chart called What Do I Fill Out? On the right side of the chart, you'll see which sections the clinician is responsible for completing in the progress note. These sections include the HPI, Clinician HPI, the examination section, the assessment, and the treatment. Lastly, the next appointment screen. We will begin with the Clinician HPI. To access any of these sections, you simply click on the blue hyperlink for that section. Once you are in one of the blue hyperlinked sections, you can also use the picture icons to navigate to the other sections. Throughout this training, since we're going through a primary care appointment, I'm going to click through using these arrows on the bottom right. But as you're navigating in a typical appointment, you will be going back and forth between sections, so I recommend using these picture icons. As you hover over them, it will display which section it is. Currently, we are on this icon for HPI. Now that HPI is open, we're going to click on the Clinician HPI tab and go into the Notes field for complaint number 1. This is where you will write the subjective, the portion of your note where you're describing the patient's symptoms and their story. For example, maybe the patient is presenting with migraines and you're filling in the rest of your HPI. So you're going to type into this white box. We don't use these drop-down menus, so just this is free text. And then you will press OK. This will populate your notes directly into the complaint number 1 box. If the patient is here to talk about one of these other typical complaints, then you're going to use the notes box for that specific complaint. So for example, this patient has diabetes and they're here to talk about diabetes, so we'll use this box. And then you'll use a separate complaint box for each complaint. So if they're here to talk about migraines and diabetes and maybe they have the flu, then you're going to be using 3 different boxes. That is the HPI section. Next, we're going to go to the examination section. The examination section is where you will record your observations during the physical exam. You will notice that in these fields you have different parts of the body and different body systems. You are required to fill out the observation portion for the part of the body that you are checking. You do not need to complete every single field, just the ones that you are actually examining. For example, if I am examining the head, the eyes, and the ears, then I will fill out just these 3 fields. To fill out the field, you click into it and you free text your notes. this is the head. So maybe we're saying everything looks normal, and maybe there's some scarring. And we can also use these shortcuts on the left to add those notes directly in. When I press OK, it's going to save what I just typed in and put it directly into the observation column. These green arrows are shortcuts that add the normal into that category. So let's say that we check the eyes and everything looks normal. We can use the green arrow to populate that in for us. We can still go into that field and edit as needed and press OK. Once you are finished filling out all of the fields that you've checked, you're done with the examination portion. Please do not record any notes in this box. We ask that you record all of your notes in the corresponding fields above. Now we're going to move into the assessments portion. The assessment screen is where you will pull up ICD-10 codes. The only thing that you're doing on this screen is pulling up codes. We are not recording any notes on here. This is just for ICD-10 codes. There are two scenarios. One, you're pulling up a code that's already been diagnosed for this patient, or two, you're putting in a new code. To pull up a previous code, you go to Previous Assessments. This will list all of the diagnosis codes that have been made for this patient during their time at Crossover. When I scroll down, I can read through all of them. And if you would like to talk about one of them today, you will click on it and it will add it into the selected assessments. Selected assessments is what will appear in your progress note today. So let's say I want to talk with them about their hypertension and also their type 2 diabetes. You'll notice that this PL column has some check boxes. The check boxes mean that this item is on the problem list. So when it's checked off, it is on the problem list, which we can see over here on the right chart panel. However, if I add something in and it is not a problem list item, for example, this general medical exam, then the PL box will not be checked off. So that means that it will still be in today's notes, but it's not going to show up on their problem list. If you add a new assessment, then you go to this white box on the left, you type in your assessment, migraines. Whenever you see a diagnosis in blue, that means that it's going to require you to answer some more questions about that patient's diagnosis. So for example, here we selected migraines and it wants to know, do they have it with aura or without aura? So let's say with, and maybe this first option, and let's say intractable. So now I can select my ICD-10 code and press OK. That's going to add my diagnosis directly under selected assessments. So as you can see here, there are 3 items in my problem list, or that will be my problem list because they're checked off. There is one that won't be. However, since all of these are under selected assessments, they will all be in today's progress notes. So just to clarify, it is not necessary for this box to be checked off in order for it to be in today's notes. This box just indicates if it will be in the chronic conditions list, the problem list. That is all we do on the assessment screen. So now we're going to move into treatment, which you can access using this mortar and pestle icon at the top. When I click on the treatment screen, you'll see that there are multiple tabs up here at the top. These tabs correspond to the assessments that we have pulled up on our assessment screen. For each assessment, you will have a tab, And on each tab, you'll have a notes box. So this clinical notes area at the bottom is where you'll type in your treatment notes for this specific assessment. Right now I'm on essential hypertension, so when I want to talk about essential hypertension, I need to be on this tab down here under clinical notes, and then I will talk about anything that I've instructed the patient on, or education materials, or maybe the plan for the medication. So this is where I'll put my notes in for hypertension. This is the treatment plan. Then when I go to my second tab, you'll notice that this is blank. That's because these work like spreadsheets, so it's a separate box for a separate assessment. So this is type 2 diabetes, so this is where I'd put in my diabetes notes, and maybe I instructed the patient to exercise for 30 minutes a day, 5 times a week. And that would be my diabetes notes area. And then so on and so forth with all the rest of the assessments. And that is how you record notes for the treatment. This is also where you will be putting in your own assessment. Again, you're not putting any notes on the assessment screen, just on this treatment screen. Now we are going to talk about medication. The medication process in eClinicalWorks is a 2-step process. The first step is placing the medication order. The second step is e-prescribing, which means sending the RX directly to the pharmacy electronically. This is not a complicated process. However, we do have a separate packet for you on how to order and e-prescribe because there are several details. So we're going to start out with step number 1, which is placing the medication order. And there are 3 scenarios for this. There is ordering a new medication, there is refilling a medication, and there's titrating medication. So all 3 of those scenarios happen a little bit differently. And then step number 2 is e-prescribing, and that happens just one way. So you'll see in your packet that we're going to go through each scenario, and then we're going to go through e-prescribing at the end. So scenario number 1 is ordering a new medication. To do that, you're going to go to this Add button on the treatment screen. You're going to associate your medication with a diagnosis. So let's say we want to order something for hypertension. We check off that box. Then in the Find box, we're going to search for maybe lisinopril. You're going to use a single click to click on the medication. And after that single click, you're going to see several options appear. This is really important that your next click be on the pencil, which is the second column, because the pencil is what will take you to the editing properties window. So we're going to click on the option that we want to select using the pencil, and that will take us to this editing window. From here, we can adjust the strength, the take amount, the route, the frequency, duration, and dispense. So let's say that we want them to take it once a day, but we would like them to take it with food. So we can type in here in this white fields with food, and you'll notice now when I click out of it that the dispense amount disappears. This is because it can no longer calculate it since we've adjusted the frequency. So you'll have to enter this manually. And if we're taking this once a day with food for 30 days, it's going to be dispensing 30. So you can use this up here to fill it in. You can also use the caret. So you can use the keypad. Using your mouse, click on the numbers you want to select and then OK. And perhaps we would like 1 refill for this. We're going to click on the caret and then the number 1 and click OK. And now you'll see on the bottom where it says RX, this is what prints out on the label for the patient. So this is what the patient will see on their prescription bottle. When you're finished editing your prescription, you're going to press apply, and now that medication is going to drop down under the selected assessment that we've associated it with. So now we'll press OK, and that takes us back to the treatment screen. When I click on the tab for the assessment that I ordered that medication for, now I'll see that medication on this spreadsheet. So you can see it directly associated with hypertension here. And that was scenario number 1, ordering a new medication. Now we're going to talk about scenario number 2, which is refilling a medication. This starts out by clicking the current RX button. The first step here is to choose which assessment you're associating this medication with. So I've just checked diabetes. And then let's say that I want to refill metformin. So everything that's listed here is what the patient is currently taking. And normally you wouldn't see this in here twice. This is because we're in the test environment and we've practiced a lot on these patients. But we're just going to choose one of these. And there are 5 circles here. There is continue, R for refill, 30 for 30-day refill, 90 for 90-day refill, and S for stop. So we're going to choose for a refill one of these 3 options in the middle, R, 30, or 90. Since we want this patient to have a supply for a while, let's say we want them to do a 90-day supply, we're going to click on the 90. And that's going to bring our medication down under the assessment that we associated it with over on the left. So you can see now that this metformin is associated with the type 2 diabetes. Then I'll press OK. That takes us back to the treatment screen. And now when I go to the type 2 diabetes tab, I can see that my metformin's in there. Whenever you refill a medication, you need to go into the tab and check to make sure that all of this is filled out. So it looks like we're missing the dispense amount. We're going to click into dispense and we're going to add something in here using the caret. So if they're taking half a tablet once a day for 90 days, that's 45. And then we'll press apply. It's very important that you check to make sure that all of these are filled out. These over here are not mandatory, but these are. So if you try to e-prescribe this without filling these fields out, then you'll get an error message and it won't go through to the pharmacy. So make sure that you check that all these fields get filled out. So that was scenario number 2, refilling a medication. Now we're going to talk about scenario number 3, which is titrating, increasing or decreasing a dose. So that starts out the same as refilling a medication, but there are a couple different steps at the end. So we're going to go up here to current RX. Then we're going to choose the assessment on the left that we want to associate this medication with. And let's say that we want to titrate their Tylenol. So this time, instead of choosing one of the refills, we're going to choose the C for continue. And that is going to associate that medication with this assessment. You'll see it's popped down under migraines. I press OK. Now when I go to the migraines tab, you will see that it is under Tylenol's under migraines and that there's this continue here. So now we're going to choose continue, click on continue, and since we're titrating it, we're either going to increase it or decrease it. Let's say we want to increase, and then we press next. And let's say that we would like them to take this 3 tablets as needed, and that we want them to do this for 30 days. And if this is every 4 hours, if this is every 4 hours, 6 hours times 4, so this would be 540. It's kind of a silly example, but we're going to go with it. And then down here, this is what gets printed out on the bottle. Press apply. And we've just finished titrating our medication. So far, we have ordered a new medication, we have refilled a medication, and we have titrated. So those are the 3 scenarios for placing the medication order. And like I mentioned before, each medication is under the tab that you associated it with. So the next step is going to be e-prescribing. We haven't actually sent anything to the pharmacy yet. E-prescribing does not exist in the test environment, so I'm going to show you with a test patient in the real environment how to e-prescribe, and you can just watch this part on your computer since it won't exist on your test environment. But as you can see, I have my test patient, I have my medications in here. So from this treatment screen, I'm going to choose the caret next to Send RX, and I'm going to click on ePrescribe RX. When I choose ePrescribe, you will see that the pharmacy option is going to be pulled up. We're going to choose our pharmacy. So you can search for your pharmacy. Let's say we want to use Crossover. Then in notes to the pharmacist, you can put in notes. This is optional. This is only going to be seen by the pharmacist. Do not fill. I'm just telling them not to fill it because this is a test patient. And then you choose which medications you want to send to this pharmacy. So maybe I only want to send the first one to this pharmacy, and maybe I want to send the second 2 to a different pharmacy. So I select just the medication I want to Crossover, and then I press Send ePrescription. If everything is filled out correctly, you're going to get this ePrescription transmitted successfully window. So I'll press OK, and now you can see there's a little lock because that medication has been sent to the pharmacy. So once you e-prescribe, you can't make any changes to this prescription. It's already sent. So I sent that one. I did not send these, which is why there's no lock. And I wanted to send these 2 to a different pharmacy. So now I'm going to e-prescribe again. Go to Send ePrescribe RX. And I'm going to fill out this form again for the second pharmacy. So just to clarify, you fill this form out it's per pharmacy. So if I'm sending my medications to 3 different pharmacies, I'm going to fill out this form 3 times. If I'm sending all the medication to one pharmacy, I'm going to fill this form out 1 time. So in this example, I just sent 1 medication to Crossover. Now I'm sending 2 to Walmart. So my 2 are selected down here. I'm going to choose Walmart as my pharmacy. And maybe we want to send it to this Walmart on Iron Bridge. And if I have any notes to the pharmacy, those would go in here. Then I would press Send ePrescription. I'm going to cancel this just so it doesn't go to Walmart. And that is how you would e-prescribe. Once you have e-prescribed, you close the treatment window and you go to this button up here called the Patient Hub. This is to the right of the patient's name. On the Patient Hub, there's a button, the bottom left, that's called e-prescription logs. We're going to choose that button, and you're going to change this provider drop-down to all. This will show you the most recent medication that has been e-prescribed for this patient. So you can see I just sent this today at 11:16 a.m. and it says that it went through successfully. So what this means is the pharmacy has received our e-prescription. It doesn't mean that they filled it yet, but they've successfully received it. Then I'll close this window and I'll press close. If it was not successful, if it said that it had failed, you would want to go back and e-prescribe again. So you'd go back into the treatment screen and you'd go down to the caret and press e-prescribe. So that is how you order and e-prescribe medication in eClinicalWorks. Now we are going to talk about a few medication resources that are outside of eClinicalWorks, but they're on crossover computers. So from any crossover computer, when you click on the Internet Explorer tab, it's going to automatically load 4 tabs for you at the top. The first tab is for clinicians. It has some resources on our prescribing and our pharmacy formulary. It also has some resources and protocols for you all as clinicians. The second tab is the Crossover Pharmacy Formulary. This will show you what we have in our formulary at Crossover. As you scroll down, you'll see that our medication is divided up into categories to help you identify what we have in our pharmacy. There are also these tabs on the bottom, which will show you our vaccine information, insulin, and a few other tabs. Then at the top, we also have a GoodRx shortcut for you. GoodRx is a price comparison tool, and you can use it to identify the cost of prescriptions at various retail pharmacies. So let's say that we would like to search for lisinopril for a patient. We type in lisinopril. Then right here, you're going to put in the patient's location. So maybe they live in the Fan area. I'm going to put their zip code in, and here I'll see the various retail pharmacies that are near that zip code and how much lisinopril costs at those pharmacies. So at our pharmacy, all our medications are $4 for a 30-day supply and $8 for a 90-day supply. However, sometimes it's difficult for our patients to get transportation to our pharmacy, and so it's very valuable to use goodrx.com and try to find a pharmacy that's close to them and affordable for them. So let's say they want to go to Rite Aid. We're going to click on Get Free Coupon. You can print it, email it, or text it to the patient. We will come back and review this last tab a little bit later, so you can minimize Internet Explorer and go back to the treatment screen. And that is the medication portion. Now we are going to talk about how to order a lab in eClinicalWorks. To do so, from the treatment screen, click on the Browse button in the Labs box. There are 2 kinds of lab orders at Crossover, in-house labs and outside labs. Let's talk about in-house labs first. This is our list of in-house labs. To order an in-house lab, first choose the ICD-10 code that you are associating this order with on the left. You can choose more than one if applicable. Then, change your search criteria from starts with to contains. Click into the lookup box and search for the name of the in-house lab. You will see multiple options. The one that you'd like to select is the IH. This stands for in-house. Click on the in-house lab. This will prompt the ICD-10 CPT Association box. This box requires you to pair an ICD-10 code with the lab order you have placed. please check to make sure that the order is associated with the correct ICD-10 code and then press OK. Notice that now your lab order has moved under today's orders. This indicates that you have placed an in-house lab order. All other labs that are not on our list of in-house orders are considered outside lab orders. Outside lab orders are labs that we draw at crossover and send to an outside lab company. To order an outside lab, first click on Future Orders. This will be gray at first and will turn green once it is selected. Then, check off the box next to the ICD-10 code that you would like to order this lab for. Then, search for the name of the lab in the lookup box. You will likely see several options for the same lab. One option for each clinic location, and maybe an option for one of our clinic programs. Choose the option for the location of the clinic that you are serving at that day. Today I am at the Henrico Clinic, so I will choose the Quioccasin Road option. Now the lab order will populate under Future Orders. Scroll down to see the order. Click into the date to open the calendar and select an approximate date of when you would like the patient to come back to have their lab drawn. If it is a fasting lab, check off the box under F for fasting. Now you have placed an outside lab order. Click the OK button at the bottom of the screen to finish placing the order and return to the treatment screen. I will press the X, which also saves my data. Next, we are going to talk about how to order diagnostic imaging in eClinicalWorks. From this treatment screen, we will select the Browse button next to Diagnostic Imaging, and then select the ICD-10 code that you would like to associate the imaging study with. For example, maybe we would like to order something for intractable migraines. Then choose the search criteria as contains, and we will look it up in the lookup field. An X-ray, for example, is spelled X space ray space colon, and then you can search for what you're looking for. Maybe we want an X-ray of the skull. You'll notice that there are two options for each sort of test because we have two locations and we partner with two hospital systems. So if you are at the Cowarden location, you're going to choose the HCA option. If you are at the Henrico location, you're going to choose the Bon Secours option. Today we are at the Henrico location, so I'm going to choose the Bon Secours. And then I'm going to press OK at the bottom, and that puts in my diagnostic imaging order. Whenever you order an X-ray, also be sure to complete the X-ray order form, which is located in the exam rooms at each location. The X-ray order form has a place for you to indicate what you would like the patient to receive an X-ray on, and on the back it has instructions for the patient to go to the walk-in clinic. Again, these are only for plain X-rays. Now we are going to talk about how to make a referral. This process begins with the checkout sheet at Crossover. On the back of the checkout sheet, you will see two options, Crossover Referral and Access Now Referral. The first step in making a referral is identifying which one of those options it is. A Crossover Referral is a referral to someone inside of Crossover, one of our volunteer specialists, for example. An Access Now referral is a referral to someone outside of Crossover because we don't have that specialty in-house. So, in order to determine whether or not the specialty you would like to send the patient to is available at Crossover or not, you're going to go to Internet Explorer and choose the last tab. This is called Crossover In-House and Outside Referral Availability. On the left, you will see specialties, and the next column show you whether or not we have them at crossover. For example, there's a Cowarden and West End column, and then Access Now. So if I'm looking to send my patient to an allergist, it looks like we do not have an allergist at either of our crossover locations. However, they are available through Access Now. So on my checkout sheet, I would mark off an Access Now referral. To place this referral in eClinicalWorks, I'm going to go back to my treatment screen and choose the diagnosis that I would associate this referral with. For example, if I'm sending them to an allergist and I think that this might have to do with their migraines, then I'm going to associate this with the migraine assessment. So I click on the migraine tab. Then I'm going to choose Outgoing Referral, and the referral window will appear. On this form, you're going to fill out only a few fields. The fields that you need to fill out are specialty, assigned to, diagnosis reason, and structured data. So let's begin with specialty. We said that we're going to send them to see an allergist. And the assigned to, you choose between two options. We're going to ask you to choose either referrals Cowarden or referrals Henrico, and that's based off the location that you're volunteering at that day. So today, I'm at the Henrico location, so I'm going to choose referrals Henrico. Then, my diagnosis reason, I press Add, and this adds a row in to add the description. So this is where I'm going to explain why I'm referring this patient to an allergist. Referring patient to see an allergy specialist because, and the rest of my reason. If my reason is longer than this row, I need to add another row in to complete my description. Lastly, you're going to go to the Structured Data tab and complete this first question on the referral system. Double-click into this column until the drop-down menu appears, and then select one of the first two options. So it's either an in-house referral or an Access Now referral. Based off of our investigation earlier in Internet Explorer, this is an Access Now referral. So I choose Access Now. The last thing to point out on the referral screen is the priority button. If this is high priority, please change the drop-down menu to urgent or stat. Otherwise, we will leave it on routine. And then I'm going to press OK. Do not press Send Referral. Now direct your attention to the checkout sheet. On the checkout sheet, there is an area for you to indicate when you would like to see this patient again for a follow-up appointment. There is also an area to indicate when they should return for a nurse visit and a lab visit. Please make sure that you fill this out accordingly. On the back of the checkout sheet, there is a referral section, which we discussed earlier, and there is a section to mark off if you've ordered any x-rays or other imaging for the patient. Please give the checkout sheet to the patient at the end of the visit. They take that with them to the front office and use that to schedule their appointments. Occasionally, it might be necessary to order an immunization. This is a two-step process which involves checking their history, step 1, and ordering the immunization, step 2. To check the patient's history, you go to this immunization button at the top, and this will list the immunizations they have had at crossover. An NEP means that it's pending, so that means they haven't actually received the immunization yet. It has been ordered, but they haven't received it. So once you check the history and you close it, you can go down to this immunization hyperlink, click on it, and this is where you will actually place the immunization order. You go to the Add button, and then over here on the left, you select the immunization that you would like to place an order for. For example, maybe I would like to place an order for Hep A. You indicate whether or not this patient has been given this vaccination in the past, and then you select the assessment that you're associating this with and press OK. Now the order is placed for this patient. I'm going to close this window, and the order is in the progress note. The last piece of the progress note, which you must complete as a clinician, is the next appointment section. We can get to this section by clicking on the blue hyperlink called Next Appointment. Then, in this follow-up box, we're going to record when we would like this patient to return for a follow-up appointment. You can use these boxes as shortcuts, or you can type it in with free text. So maybe we would like them to come back in 3 weeks. If you are a scribe watching this video, you also need to include the scribe signature, which is scribed by then your name, first and last name, for doctor, and the name of the doctor, or the name of the clinician that you are working with. Today we are scribing for Dr. Murchie, so I'm going to say that. Lastly, you press the close button. And now you have finished the progress note. As you can see, everything that we have recorded is now appearing in our note for today. The last step is locking your progress note. Locking your progress note will turn the note into an uneditable format, so be sure not to lock it until you are completely finished with the note. Once the note is locked, you will not be able to edit anything in the note, including prescriptions or referrals. To lock the note, you go down to the bottom next to lock and click on the green caret. Then you choose Modern 1 Style. And yes, you want to lock the encounter, so press yes. And this turns the note into a nice format. It signs the note with your electronic signature. Again, this should only be locked by the clinician. Scribes who are watching this video, you are not allowed to lock the note because it is under the clinician's name. So, if you are scribing for a clinician, please make sure that they are logged into their account and that they lock the note. Now that we have locked the note and we're finished seeing this patient, we want to return to the office visit screen so that we can see if our next patient has arrived. We go to the S jelly bean at the top right. Here we're going to change the status from Start Visit to All Done to indicate that we have finished seeing our patient. You'll also notice that your patient's name is highlighted in green because you ordered an immunization for this patient. This notifies the nursing team that there is something more for this patient to do before they check out. At this point, we have successfully completed one full appointment in our test environment. I'm going to show you how to log out of eClinicalWorks. So at the top right, you're going to choose this close button and then say yes, we want to close the application. Then we're going to choose yes and close out of Internet Explorer. Thank you for watching this EHR training video. Please let us know if you have any questions. We're always happy to help in any way we can. We look forward to seeing you in the clinic very soon.